Welcome back to your Pediatric Dentist channel Tiny Tate Talks. If you are new to this channel, subscribe the channel, and for details of this channel visit the bio section, or you can also check out my first video. Sorry if there is any mistake in videos or shorts. Today we will discuss small important topic which is computerized growth forecasting (CGF). This is not so common but important topic for short note in exam point of view for both undergrads and postgrads. Understanding the growth and development of the craniofacial complex is crucial for predicting facial and jaw growth, enabling clinicians to diagnose and plan treatments effectively. Computerized growth forecasting uses advanced algorithms to predict these changes accurately based on historical cephalometric data and biomathematics. Coming to the history, the first contribution given by Ricketts. Ricketts was a pioneer in growth forecasting, recognizing its clinical usefulness in the 1950s. He laid the foundation for computerized growth forecasting by investigating the direction and magnitude of craniofacial growth. Then second is Skuloff and Berger's contribution. They built upon Ricketts' findings and utilized biomathematics to computerize the growth and development of the craniofacial complex. This approach, known as a computerized growth forecasting, allows for more precise prediction of growth changes. Prediction of growth changes requires specification of the amount of growth change at a given point in a given period and also the direction of growth. Several studies were done in which children who needed no orthodontic treatment were used as subjects, analyzed their growth prediction. Cephalometric radiographs were taken at regular intervals and the data was grouped to provide a picture of normal growth changes. The major difficulty with the growth prediction based on average changes is that an individual patient may have neither the average nor the amount or direction of the growth, and thus there is a possibility of significant error. There are some specific predictions validated. The first is cranial base prediction. The cranial base plays a crucial role in the growth and development of the entire cranium. So the cranial base is marked by a line joining the basion. This is the basion, which is the anterior point of the foramen magnum, and the nasion, which is the anterior point of the frontal suture. In a normal child, the cranial base grows approximately 2 mm per year, 1 mm forward growth of the nasion and 1 mm backward growth of the basion. Coming to the mandibular growth prediction, there are two axes. First is condylar axis, defined as a line from point on the basion-nasion line. This is the basion-nasion line, defined as a line from a point on the basion-nasion line midway between the anterior and posterior border of the condylar neck, which is the DC point, to the geometric center of the mandibular ramus, which is the XI point. During 1 year of growth, the XI point grows downward along the condylar axis by 1 mm and corpus axis. So the length of the mandibular body is defined by a line from the XI point to the anterior point of the mandibular symphysis, which is pogonial, and each year the corpus axis grows approximately 2 mm. The angle formed by the condylar and corpus axis describes the configuration of the mandible. This is the angle. If there is a small angle, it indicates a steep mandibular plane and a vertical growth, and large angle indicates a square mandibular plane and a forward growth. Coming to the maxillary growth prediction, so there are some points and angles. Point A, located on the maxilla, grows forward at the same rate as the nasion. An A angle, this facial reference line remains consistent during the growth. Skeletal convexity, which determined by the relationship between point A and the facial plane. Convex profile, when the point A is forward ahead of the nasion to pogonian line. This is the nasion to pogonian line. So if point A is ahead of this line, then there is a convex profile, and when point A is backward of this line, then there will be a concave profile. Dentition related to A2 pogonian line. Lower incisor maintains a constant relationship with the A2 pogonian line throughout the growth. Normal distance is 1 mm from the incisal edge to A2 pogonian line. Upper incisor normal distance is 3.5 mm from the incisal edge to the A2 pogonian line. Interincisal relation, the normal angle is 130 degree with the upper incisor at the 28 degree and lower incisor at 22 degree to the A2 pogonian line. Molars, in class 1 relation, the distal surface of the upper molar is 3 mm behind the distal surface of its lower counterpart. Coming to the visual treatment objectives, so VTO helps in diagnosis and treatment planning by anticipating changes in the growth and incorporating them into the treatment design. Bench's contribution, he introduced the concept of orthodontic treatment design to computerize growth, creating the VTO, visual treatment objectives. So the treatment design procedures, changes due to the normal growth, accounts for a normal growth in the cranial base, chin and maxilla. Orthopedic alterations, factors in the changes due to the orthopedic interventions. And orthodontic movement visualization, projects the movement of the teeth within the jaws to achieve the more normal relationship. Importance of the VTO. VTO considers both normal growth and alterations due to the treatment, helps clinician anticipate changes and plan treatment procedures more effectively, provides a visual representation of the expected outcomes, enhancing the precision of the orthodontic treatment. There are some software used nowadays for these CGF and VTOs. For example, Planmaker Omexis, DTS Pro 3D VTO software. Coming to the example of this whole system. So for example, there is a 12-year-old patient and diagnosis is class 2 malocclusion with an overjet of 6 mm and deep bite. So the treatment objective will be reduce overjet to 2 mm, correct deep bite and improve facial aesthetics. So what are the steps? The first, initial cephalometric radiographs are taken to assess the skeletal and dental relationship. Using computerized growth forecasting, the expected growth of the patient is predicted. These include the growth of the mandible and maxilla. Then a VTO is created using the predicted growth data. The VTO shows the expected changes in the patient's facial structure and dental alignment over time. Based on this VTO, a treatment plan is formulated. These may include the use of functional appliances to encourage mandibular growth, followed by fixed orthodontic treatment to align the teeth. The patient's progress is monitored regularly and adjustments to the treatment plan are made as needed based on the actual growth observed. Computerized growth forecasting, including maxillary growth prediction and VTO, play a critical role in modern dentistry. By understanding the growth patterns and incorporating them into the treatment plans, clinician can achieve better outcome for the patients. These are the references. If you want this PDF or any other PDF, just like, subscribe and comment your mail ID with the topic and I'll send you the PDF. New videos on Sunday. Also, we try to put MCQs according to topics on our shorts with the answers and explanation if needed, which will help you in the Viva and NEET exam. Like, share and subscribe the channel. Thank you.